The broadcast is now starting. All attendees are in listen-only mode.
All right, we're at the top of the hour, so it's time to get started. Good evening and welcome to our How It Works webinar with 6-month smiles. We are so glad that you are here taking the first step into learning more about who we are, what we do, and how this system can make an impact in your practice. I am your host, Joanna Daskovich, the Inside Sales Rep for 6-month Smiles. Before we get started tonight, I want to let you know of a couple things. Tonight's webinar will be approximately 30 minutes long. You will see on the right side of your screen a place to submit your questions. We will get to those at the end of the presentation. Also, stick around at the end of the webinar because I have a great deal for you. You are in for a special treat tonight. Your instructor is one of the best in the business. He is the director of the Staplehurst Dental Practice in Kent, is a third-generation dentist who qualified from the Royal Dental College in Copenhagen. I'd like to introduce you to one of our favorite international clinical instructors, Dr. Jan Einfeldt.
Thank you very much. I think my head is big enough already. Thank you for the introduction. It's exactly as I wrote it. Thank you. Thank you to all the attendees here, taking the time out of their busy days to learn about cosmetic teeth straightening for general dentists, because this is really a program that is made for general dentists who may have very little or even no experience in orthodontics. So this is what we're trying to explain tonight, is how general dentists can actually benefit from treating their own patients, and how the patients, your patients, can benefit from cosmetic teeth straightening. So this is a cosmetic teeth straightening system. It's not a comprehensive teeth straightening system. I'm not an orthodontist, I'm not a specialist, I'm a general dentist just like you, but I've learned the tools and the ways to assess patients, how they can be treated with cosmetic teeth straightening. Here we are. The British Orthodontic Society, the BOS, did a survey in 2010 and found out that a very big proportion of the population is actually unhappy with the appearance of their teeth. So it's nearly half of the adult population are not happy with their smile. But what happens when we go to the dentist, or when the general public goes to the dentist, they have their teeth checked. The dentist says, oh yeah, you're fine, everything's okay. But a lot of these patients are actually not okay. They're not happy with their smile. And with orthodontic appliances such as 6-month smiles, we can now, as general dentists, treat certain kind of these malocclusions. So these are the patients we see in our everyday practice. We see lots of these patients every day. And we think, well, as long as there's no tooth decay, as long as there's no periodontal disease, that they are okay, that they're fine. But if you actually took the time to ask your patients, how do you feel about your smile? Some people use smile questionnaires when the patient's coming in, but I often find it's also very good talking from one person to another, or even a staff member, because when the patient sits in the dental chair, they're often nervous, they're a bit anxious. And when the staff member speaks to them and they find out, for example, they're getting married in a year's time, a lot of them actually have an issue with their smile, and they actually don't know, many of them, that you can actually have cosmetic teeth straightening in a relatively shorter amount of time than comprehensive teeth straightening usually does. And these patients you see here in front of you, if these patients were sitting in your chair, how would you treat them? You would probably not use veneers for these patients. You would perhaps consider something like aligners as well, but aligners will invariably take longer for certain type of movements. I treat my patients with aligners as well, but I give the choice to the patient and say, would you rather have a treatment that's going to take a bit longer, then you can use aligners, or would you like to have a treatment or some cosmetic braces that saves you some time and usually also some cost as well. And then the patient usually makes a decision based on that. So 6-month smiles really is a system created for general dentists that makes it easy for general dentists to fit braces, because you don't have to do individual bracket bonding at the braces on appointment. They're all preset for you. The digital treatment planning is done by orthodontists so that you also have a plan what to do at each month. This is called CONFI. We get a bit more into that a bit later on. And there's a step-by-step system really that makes it very easy for you to position the brackets in a short amount of time. The wires we're using are NITAR wires, shape memory wires, so you don't have to bend the wires. You will learn how to bend wires for fine-tuning during seminars, that's true, but otherwise you do not have to start wire bending if that's what they taught you at university. Here it is a straight wire system. We use lucid lock brackets. They're clear brackets that are especially designed for short-term orthodontics. They're easy to place for general dentists as well. And we are trying to fix the patient's main concerns in about 4 to 9 months. So the average treatment time may be 6 months, but it can be as short as 4 months, maybe, depends on how severe the case is, and maybe up to 9 months, could be 10 months, could be 11 months, depends on how efficiently you treat the patient, but that is sort of the treatment time we're looking at for patients. And here's a good example of what a patient looks like on the left side. We can see that there's some crowding in the upper arch. We can see some teeth that are sort of a bit further forward, some a bit further inwards, palatally, retroclined, and then we see the braces fitted in the middle, clear braces, so quite cosmetic braces, and I show my patients usually these photos, or even a model with braces on, and I let the patient decide and say, could you wear something like this? And then the patient usually says, well, actually, this is not as bad as I thought, this is not that visible, so yes, they can wear those braces. And on the right side, you then see the result that can be achieved in 6 months, for example. But we must not forget that this is not comprehensive teeth straightening. Comprehensive teeth straightening is still the gold standard, and in comprehensive teeth straightening, we're trying to get everything as close to the ideal molars, canines class 1, the ideal overbite and overjet and root positions. And that is great if the patient wants this, and I always offer my patient this. However, a lot of patients say, but I don't want to wear fixed braces for maybe 12, 18, or 24 months. I just don't want that. Then I'd rather not have any braces whatsoever. Is there not anything else that you can do? And if you give the patient this choice and the option of comprehensive ortho, then you can also get consent from the patient if they say, yeah, but the overjet is not really the big problem. The space behind the front teeth. I always try to explain it in words that the patient can also understand, because they don't know what overjet means. So I usually say to them, look, you've got an increased overjet, which means you have some space behind your upper front teeth. And if you're okay with that, and if you can live with the fact that we're not getting that as good as we possibly could get with comprehensive ortho, then you could have very straight teeth. And if the patient is okay with that, you can actually get consent to doing cosmetic teeth straightening, which is not as big a goal as comprehensive teeth straightening. So it's very important that we understand what are the issues that we're trying to resolve here for the patient. Because if it's everything we want to fix and get everything as close to ideal, then we have to go down the route of comprehensive teeth straightening. But even with cosmetic teeth straightening, we can solve things like crowding, overlapped teeth, anterior cross bites, we can close spaces, we can to a degree treat open bites as well, deep bites, over-erupted teeth. We're simply rounding out and leveling out the arches, which is usually what the beginning is of comprehensive teeth straightening. But that's where we end, that's where we stop. So we're not changing angle class with cosmetic teeth straightening. And ultimately, it's the patient's choice. So I give my patients this option, and I say to them, what do you prefer? And a lot of adults do not want comprehensive teeth straightening and opt for the cosmetic teeth straightening. So here's another example of a patient, and you see on the top left side what the patient looked like before. This is probably quite a young patient, because you see after a month already how far the canines have come down. So on younger patients, the teeth move even faster, but quite dramatic if you think that the braces have only been in for a month's time. And you also see on the bottom row, you see the occlusal view, and you see how fast actually teeth can actually move, because this is only tipping and tilting movements we're doing. And tipping and tilting movements are much faster than moving the root tips through the bone. And that is what comprehensive teeth straightening does, but that takes a lot longer. So in a really reasonable and short amount of time, the patient's cosmetic appearance can actually be improved significantly. And this is something I think we should keep in mind, that we're trying to improve aesthetics. We're not necessarily going for perfection. If a patient wants perfection and is close to ideal, this is where I steer them towards comprehensive teeth straightening. So here's the example after sort of the different months. You can simply see how the teeth are straightening out more and more, with the wire to begin with was sort of a bit crooked because it was going through the brackets, and then as the wire straightens itself out, it's taking the brackets and the teeth with them, and that's what makes the teeth straight. So when eventually the wire is straight at the end of the treatment, the teeth are straight as well. So general dentists can actually perform orthodontics. A lot of general dentists that I speak to have actually been taught orthodontics at university. The problem is many of them have just not been encouraged to do it later on as well. And then there's so many other things that we do when we get out in practice, and orthodontics may not be sort of what general dentists focus on a lot. But this has changed a lot over the last few years, especially with so many different cosmetic teeth straightening systems, whether they're fixed or removable, and aligners out there now. I think many general dentists are picking up on the fact that you can actually, as a general dentist, help your patients as well. The important thing is to know when to treat a patient and when not to treat a patient, when to refer them on. So on a 2 days hands-on seminar, general dentists learn what you can treat, what you cannot treat, how best to treat, and so on. So we're simply making it a bit easier for general dentists again to get back into orthodontics, which many of you actually enjoyed when you went to university, but it was just not really emphasized that this is something you'd be doing later on as well. So the reason that dentists like 6 Month Smiles is because it is made easy for them. Because we have online protocols, the treatment planning by orthodontists. We haven't shown you the CONFI yet, which is a digital treatment planning, which also gives you a visual of what the result is going to look like at the end. So it's made easy for the dentist. It's very effective, the treatment. The teeth move very quickly as well. And the patients are happy with this because the patient actually can understand better if they see a preview of what their teeth are going to look like. Most cases will finish in about 6 months' time. That depends, of course, how severe the case is, but we're not trying to achieve the same goals as comprehensive teeth straightening. That is why we can align people's teeth, level and align people's teeth in about 6 months' time. That is what we're focusing on. And very carefully, we also have to choose and select which cases we're going to treat and which cases we're not going to treat. The great thing about the digital treatment planning is that it actually helps us to assess how difficult is it to treat a case. So it's not often a question of yes or no, treat or not treat with 6 Month Smiles. The question is also how complicated is it? Because if you are a beginner, then you might not want to get started with the most difficult case. You might want to start with some easier cases, but you don't even know what the easier cases are to start with. So this is just to show you what the transfer trays look like, with the brackets already pre-positioned, and it's made very easy for you to actually bond these brackets on in a shorter amount of time. And many of these materials you already know as general dentists because you're used to making composite fillings, so you know how to etch and bond with composite as well. Then when you have taken your impressions and sent these to 6 Month Smiles or a scan, I use a scanner, which makes life much easier. And then you actually receive a patient tray kit. And the patient tray kit includes these transfer trays you just seen. It includes some donuts, some quick ties, some wax for the patient. It includes the bonding material as well. So this is all you need for actually fitting the braces to the patient. The only thing you need on top of that is sort of the tools, but those, of course, you can reuse. But this is the individual patient tray kit, which makes treatment a lot easier for you as a general dentist. And now I'm going to show you the digital treatment planning, the CONFI. And this is what made life a lot easier since we have introduced this, because it shows us a simulation of what the teeth are going to look like, both for the dentist and also for the patient. because in some cases you might want to visualize for yourself as well. The only tooth we would normally consider extracting during 6 month smiles, if it's necessary, is a lower incisor. And sometimes you wonder, should I really be extracting a lower incisor or not? And you can simply preview this by digitally removing the tooth and leveling, aligning the teeth on a digital simulator and see what that looks like. And if you're not happy with that, then you can change it back and put the tooth back in before anything has been changed for the patient, before any teeth have been taken out. On top of that, you've got the digital bracket placement, which makes the bracket placement very accurate, very precise, much easier as well. And as a dentist, you also get a step-by-step guide what you have to do on month 1, month 2, month 3, because you see the patient every month, and you already have the pre-prepared steps ready, so you know what to do next. You still have a forum where you can ask questions, that's fine, but it's nice for you to already have sort of almost a cookbook prescription what to do. So here is actually a simulation from before and after. So on the left you see what the patient looks like before the treatment. On the right you see the simulation. So this is something you can look at yourself, obviously, or you can also show it to your patient and say, well, what do you think? Is that something that you would like? And then the patient has a chance to look, actually, that looks great. Or if there's any changes you want to do, then you can still make changes before the braces are actually made. With regards to root resorption, I know this is a question that many dentists ask themselves. The patients usually don't ask much about that, but let's talk about root resorption, because this is something that most dentists at least think about. And I thought about this when I was starting to do orthodontics as well. I thought, is this going to be a big issue? Root resorption is something that is going to happen on any form of orthodontics. The question is just how much. Some patients are going to get it a bit more, some patients are going to get it a bit less. The issue is that you are more likely to have root resorption if you're treating for a longer period of time and with heavier forces. Now with 6 month smiles and the nickel titanium wires we're using here, we're treating with a shorter, well, for over a shorter period of time and with less forces as well compared to comprehensive teeth straightening. So if anything, actually the risk for root resorption is less. But it will never be zero, because any orthodontics, whether you use aligners or fixed braces or removal appliances, for any orthodontic treatment, there is a slight risk of root resorption as well. And if you compare 6 month smiles or cosmetic teeth straightening with many other cosmetic treatments, you will find that the level of investment you have to do to begin with to get started is relatively low. If you compare, for example, something with implants, where you have to often invest very heavily in expensive equipment before you ever place your first implant, then within the first 2 or 3 cases already, you're already earning the money back you've invested in your seminar and in your equipment as well that you need as a dentist to do 6 month smiles. So very early on, this becomes profitable for you as well. And if you look at the lab fees, for example, here, it says costs involved to the dentist are on $599. If you add the digital treatment planning, it's actually, I think it's $200 more on top of that. But that includes everything, the patient tray kit that you get. So a lab fee of between £600 or £800 depends on whether you're going to order this or not. But that is much less than you're going to pay for your aligners as well. So the lab fee is less. Therefore, you can also pass the saving on to your patients as well. The chair time, it says your chair time is minimal. You can delegate certain things, but as a dentist, I quite like to control all this myself. I personally love doing the orthodontics as well, so I love putting the braces on. I think it's very relaxing to do that. There's sort of a bit longer appointments and sort of seeing 4 patients in an hour for exams or so. I quite like having these longer appointments, and ideally even back to back, you sort of get into a rhythm with this. And depending on how many cases, of course, you do per month, you can actually increase your monthly turnover quite substantially. 6 month smiles has been on the market since 2006, and there's close to 10,000 providers now. Over 150,000 patients have been treated internationally with 6 month smiles. This is just a short example here of what you get in terms of support. There's many mentors and instructors on the forum, which is free to use for you. There is webinars, there is you can watch the videos you're going to see. So a lot of the educational material you actually receive on the day of the seminars. You can watch it again from home if there's something you want to catch up on as well, which is very helpful for you. And you can download posters as well. This is a great resource for you, and the forum itself as well, because there's many other dentists who are asking questions, and where you can ask questions. You can learn from other dentist cases as well. So imagine if you could improve one of your patient's smiles, because a lot of the time you will get this question when you suggest a patient could have a cosmetic treatment. If they talk about teeth straightening and you say, well, I could refer you for this, they will usually say, can't you do it? And a lot of the time you actually can. So within the remit of what 6 Month Smiles teaches you, you can actually do the teeth straightening. And you can actually change people's lives quite considerably. I've treated a lot of patients who are about to get married and they just don't want to smile in their photos normally. So by changing the smile, you're really making their day even better, their special day. And that is great, especially when we get an email with a picture of the wedding or so. I think that's fantastic. That really makes me smile when I get a picture through emails like that. The average treatment fee is, of course, up to you. It's a private fee, so you can set it yourself. I would, of course, look at what your what you're charging in your area, or what's been charged in your area. I think this would probably be in dollars here. I think that's where it's just saying in pounds, 4,500 pounds. But ultimately, you can decide what you're going to ask for your 6 Month Smiles treatment. And I'm going to hand over to Gianna now, who's going to tell us how dentists actually can get started. Gianna, what can you tell us?
Awesome. Well, thank you so much, Dr. Einfeldt. We did have one question that came through, and I'm hoping that you can help me with that. She asked, is retention permanent?
Absolutely. Very, very good question. Brilliant question. Retention really should be kept for life, or at least as long as you want your teeth to be straight. Because if you don't retain the teeth, there is a risk that the teeth could otherwise move again. So yes, you should be telling the patients from the outset that you would need some form of retention on your teeth. And what we advocate, the gold standard, is a fixed retainer, a little wire retainer that goes behind the teeth, and then afterwards, on top of that, also a removable clear retainer as well.
Great, thank you so much. Okay, you guys might be interested in wondering how to get started with 6 Month Smiles. It's actually very easy. All we require you to do is take our 2-day seminar. Next slide, please. Okay, we have, as you can see, this upcoming year, we have 3 courses in London and 1 course in Manchester. As an appreciation for attending today, we are offering for you to take a team member to join us at no cost. You're just going to use the code TEAM, T-E-A-M, and that's it. It's that easy. If you have any questions whatsoever, please feel free to email us at seminars@6monthsmiles.com. And we will be sending out an email to everyone with the follow-up with the webinar presentation. So thank you all very much for attending today, and we look forward to seeing you at an upcoming course. Bye.
Joanna, I may just ask, also add one more thing. It's great that you actually can bring team members there for free as well, a team member. I can say now that the dentists who often do the best with 6 Month Smiles are the ones that bring 1 or even more team members as well, because the team members actually do the hands-on as well, and they learn how to assist the dentist better. So this is one of the reasons that it worked so well for me, because I brought a team member to the 6 Month Smiles course at the time. So I would strongly recommend bring a team member if you can.
Okay, great. And we are all set.
Great. So if there's no more questions, is there anything else, Joanna, that you would like to say?
Nope, we're good. Thank you so much again for attending. Have a wonderful evening. If you need anything whatsoever, please do not hesitate to reach out to us.
Joanna, thank you very much, and thank you everybody who was listening tonight.